Welcome to Prescription for Primary Care. Today we're joined by Dr. Rohini Patel. She's a physician recruiter at Can-Am Physician Recruiting. Dr. Patel earned her MD from Windsor School of Medicine in 2014. With experience as a clinic operations manager and EMR systems product manager, she brings a unique perspective to helping international medical graduates navigate their path to Canadian practice. Dr. Patel, thank you for being here today.
Thanks, Rebecca, for having me here today. It's a pleasure to join you today to discuss such an important topic in today's date. I'm excited to share insights on how Can-Am Physician Recruiting supports physicians in every stage of their journey to make sure their skills and expertise make a meaningful impact, especially on today's date where we have a shortage of physicians.
Yeah, physician, a shortage is an understatement. Your background is particularly interesting because you've seen healthcare from numerous angles. So you're a physician, a clinic manager, and now you're in recruitment. So how do these experiences help you understand the challenges facing our IMGs?
For sure, Rebecca, thanks. That's a great question. So having worked in physician recruitment and clinic operations, I've actually gained a deep understanding of the difficulties physicians face when navigating the Canadian healthcare system and being an IMG physician myself. The licensing requirements, cultural adjustments, and competitive residency process can be very daunting on physicians. My clinic management experience has shown me how critical it is to match physicians with environments where they can succeed both professionally and personally.
Okay, so you're an IMG yourself then.
I am an IMG physician myself, yes.
So where did you hail from and what was your experience like?
So I actually came from, I like you mentioned in the beginning, I did my MD. I graduated from my MD from Windsor School Windsor School of Medicine, and that was in St. Kitts. And then I went to Chicago and I did my rotations. And then obviously the residency, process that was kind of very daunting. It was very competitive. So I kind of had to step back for personal reasons at that time. But, kind of like we mentioned before, I stayed in healthcare since 2014, and I've seen, it evolve, not only like evolve the changes that have been made in, physicians treating patients, but how I don't think at that time there was a shortage of physicians we were seeing. It may be up in the air, but I don't think it was actually really out there until probably recently when I was managing a clinic, when I was a clinic manager at Toronto Pearson Airport. And there was, a shortage of physicians at that time coming on because, people were coming from airlines, being seen or getting taken off the plane. And then it was like, oh my God, we need doctors at the airport. So I kind of seen it like that.
Okay,
it's actually very, very interesting. I think, my experience working with doctors has gone back, over 12 years now. And I agree with you. I think there has been a more recent decline, I guess, in the number of physicians.
Oh, yeah.
The unattached patient population is skyrocketing, as we know, over 2 million in Ontario, over 6 million in Canada. And there's just not enough doctors. People are not going into family medicine the same way that it used to. And even if they do go into family medicine, they're not in it for their career anymore. There's so many physicians now that are retiring that have been practicing for 30, 40 plus years.
Yeah.
And all the younger physicians that I'm talking to now, they're like, oh yeah, maybe 5-10 years, and then I'll do something else and, try and figure out. They have subspecialties and they try different things. It's just a completely different landscape. And I think physician recruiting from overseas and just physician recruiting in general is a very important aspect of what we're doing. We need to be able to draw physicians from other places. We need to incentivize them. We need to, as you said, make sure they fit in both professionally, personally, culturally. There's so many different aspects that we need to work on.
Oh, for sure. I definitely agree with that.
So when you work with IMGs, you have an approach called a 3-point plan. So can you walk us through this approach?
Yeah, for sure. So the 3-point plan is designed to streamline the pathway for international physicians. So first, what we do is we assess their qualifications and career goals to identify the most suitable pathway, because every province has a different pathway for physicians. And it's unfortunate that, across Canada, it's not the same, that you can come from this country and practice in this province, but you can't practice in this province. You don't need this exam, but you need this exam. So it becomes kind of hard for these physicians. So we definitely work to identify the most suitable pathway for them. Then we emphasize on maintaining an active clinical practice or securing an associate physician role to keep their skills current. So for example, if we, connect with a physician and they haven't been in clinical practice, but, they may be licensed, let's just take, Iran, for example, they're licensed in Iran. So I do tell them that, if you've been out of clinical practice for a few months, I would suggest that if you could even do like telemedicine, to go ahead and do that, because it's really important to stay in clinical practice, because when looking to get licensed, that's what they look at. How are you in clinical practice? How many hours have you been in recent clinical practice, right? And then finally, we focus on, of course, matching the physicians with the right community while providing that support for them. So, where can they get licensed? Where is it, that it's not going to scare them away? The process is not going to scare them away. And then we're going to lose another physician coming into Canada in general, right? So that's kind of the 3-step approach that we take.
And where would you say the majority of the physicians from overseas are coming from?
Josh, it's really hard to say, because it just depends on, the physician's interest. That are they interested in moving to Canada? And, in sometimes it scares them away, because when they look at the cost, the paperwork that needs to be done, they're kind of like, oh, I don't know if I'm going to get it. Because I'll be very honest with you, when you go to the website for licensing, or even to the Royal College, there's information on there, but physicians don't know whether they're going to get it. So they may apply, but they may get denied, and then they lose their money. And that's kind of how we at Can-Am Physician Recruiting, and I really love to say that we make sure that we guide our physicians that, you are from this jurisdiction, you may not be licensed, but here, this is what you can do.
Right.
Right.
And do you sort of look to that, you sort of have the consultation with them to figure out, A, where they're coming from, and B, pairing them with the right province and right city within that province?
Yeah, for sure. So we definitely look at their CV. It's not that, they just send us the CV and we connect with them. Like, for example, if you were scheduling a, appointment with me, I'm going to review your CV, and I may know from, off the top that you may not get an eligibility to practice in Canada, but I will guide you through that pathway, like how you can do it. Like, will you have to come to Canada and do 1 year of a fellowship to match up to the, the number of residency years that are in Canada? Or 100% you're going to get your eligibility.
And which provinces do you think are sort of the most competitive or toughest to get into, versus which are the easiest and most lenient?
So for sure. So Ontario, 100%, a little difficult for IMGs coming from the non-approved jurisdictions that we say. And then difficulty, I would say British Columbia, because there is, certain specialties aren't able to get licensed there unless they are basically Royal College certified, right? Now, easier pathways are more IMG friendly, I like to say. I would say New Brunswick for sure.
Interesting. And what are the jurisdictions that people are coming from that might be a little bit more challenging?
Yeah, so I mean, in general, so obviously what the approved jurisdictions may be, right? So for example, let's say South Africa, Australia, UK, these are approved jurisdictions, but let's just take Nigeria. Nigeria is not an approved jurisdiction, right? So we kind of have to see what pathway they're going to be able to obtain from the Royal College of Physicians and Surgeons of Canada. And then once they have that, what licensing criteria do they meet for the different provinces, right? Like, have they written a Canadian exam? Have they not written a Canadian exam? Which exam did they write, right? So in those cases, we work with those physicians like that.
If they're not from an approved jurisdiction, do they sometimes travel or start working in an approved, like from Nigeria? Would they go to the
UK? So they wouldn't be able to come to Ontario. Like, so if you're from Nigeria, you wouldn't be able to come to Ontario to practice.
No, but could they go to the UK or somewhere else to practice for a little bit and then try and come here?
They can, but that's just them going to UK to write an exam or get training from there. Whereas just doing that is going to not only make them spend more money, they have to move their entire family if they have a family, but it's a longer process. Sure. It's possible, but it's a longer process. So somebody coming from Nigeria can go through which, Royal College has the practice eligibility route, which is easier for them to go through that pathway and then sit for the exam, because even if they go to, like you said, UK, they're going to still have to write the Royal College exam to get certified. So why make them go to an approved jurisdiction to get training or license there when they're going to have to come back and write the exam again?
That's fair.
Oh my God, that's crazy. So, talking about jurisdiction, just for my own knowledge, so you have 13 licensing jurisdictions. Is that 13 countries? Like, what is it?
So when we say 13 jurisdictions, so it's not 13 like countries, because I'm just looking here. So Canada, USA, Australia, Ireland, Switzerland, New Zealand, UK, South Africa, Hong Kong, and Singapore. These are the approved jurisdictions. But it's not to say that, like, if you are coming from India, you can't practice in New Brunswick. So every physician basically coming from a country can practice and get licensed in Canada. The question comes from the Royal College that does their training meet the criteria? So if we look at anesthesiology, it may be a 5-year residency in Canada, but someone from India may have done 4 years, so they'd have to come back to Canada or come to Canada, do 1 year of fellowship to make it equivalent to 5 years. So there's not specific 13 jurisdictions in that point, but each jurisdiction does have their own pathway.
They make it very complicated.
Very complicated. They make it very complicated. So, for example, in each jurisdiction, they have a unique requirement, and obviously, depending on the opportunity, they may require a specific license. But we break these requirements down for them to help them determine the pathway, which would align specifically with the qualification they have.
What about the families of these doctors? So obviously you have to bring the family when they're moving to another country. So do you support the entire family during these transitions as well?
So what we do is, when with the support, we try to support the physicians as much as we can. But obviously things like, them needing a work permit or, immigration help, we don't specifically support in the sense get it done for them. But we do have, immigration lawyers that we can refer them to get that done. Now, how to support the family. So when we have an opportunity, job opportunity, we definitely ask them questions. And when I talk to the doctor, like, okay, are you coming with family? Are you coming with your spouse? How old are your kids? What's your background? So for example, if it's a family physician who wants to come to, Ontario, what is their background? Where would they fit in? I might have an opportunity in Toronto. I might have an opportunity in London, right? It just kind of like that. And then how we work with the families is, okay, I'm sending you information based on the job opportunity. If it's in Toronto, here are some schools to look around that area. Here is kind of, where grocery stores and stuff are kind of, I don't know where they're going to live per se, but we try to, stay in touch with them as much. I do have physicians that we've placed, and I do stay in touch with the physicians on how's things going. Are you liking it? I have a physician who joined a hospital, and she moved her child. She was looking for schools. So I gave her a list of the area where she was going to be in the schools and what to look for and what to not look for.
Okay, so obviously family integration impacts retention.
It does. And, sometimes physicians will say, because when they come, they're coming on a work permit, so they have to start the immigration for their family. They may come alone. And say, I'm going to go first. And then, I've had a physician do that. Went first 6 months, kind of got settled in, found a place, and they said, okay, I'm ready to bring my family over.
With your company, Can-Am, is there a success story that you can share that illustrates how, a common barrier in the licensing process that you overcame?
Yeah, for sure. So I'll give you a success story, and then I'll give you the paperwork issue, because that's happened a lot, and I'm not going to pinpoint which jurisdiction this was. But so success stories, one of the physicians I placed, she didn't have anything. She just submitted her CV to me. She's coming to Canada. She didn't know what to do, where to go. And I guided her through the pathway. She obtained her Royal College eligibility, and she then, followed instructions on, okay, and she's a pediatrician. So she was going to get a provisional license, let's say, in that jurisdiction. And she submitted her paperwork and I represented her. And, we continuously stayed in contact with the department, and she landed her job. She's a pediatrician. She don't want to go anywhere else. She wanted to come to Canada for a better future for her family, for her kids. And that's what it was. And that's the doctor I was talking about, that, I kind of worked with her in terms of finding a school for the child and helping her kind of see where in the area that she can live. And unfortunately, because she was coming, there was no option for her to kind of buy in advance a place or find rent. So I worked with the hospital to get her kind of situated to stay for a while in for residents when they give them like accommodation. So she stayed there for a while. So that's one of my success stories. And I think that was actually the first doctor I placed with Can-Am. So I was so happy when she got it. I was like, yes, you got it. But then when we look at success stories for, paperwork, like you mentioned, I've actually had a few, this happened to a few. And because when we receive the CV and we go through it and I know, okay, they are eligible for this eligibility, they are going to be eligible for this license in this province. Like, I can guarantee when I look at a province, they are going to get a provisional or a full license. I can say that, like, hands down, you're going to get this one. So my physician got the eligibility, but got over a clinical assistant. And I said, what? No. You are not going to practice as a clinical assistant because you are eligible for a provisional license or a full regular license or defined, whatever the situation was. And so I actually emailed the college, CC'd the physician, and I said, hey, by the way, you reviewed the, Dr. So-and-so's qualifications, and you've given them the wrong eligibility. This is their qualifications, this is what they have, this is where they've trained. And then they look back and said, and the email actually said in a response, we apologize, we gave you the wrong license. Please submit us, this document and we will issue the correct license. So I was like to the doctor, go ahead and do it. They're not going to charge you for it because this was not your fault. So, we're crying for shortage of physicians. And, I don't blame that college because they're seeing so many, applications, but errors like these happen. And that's why we're there to kind of be like, when they get their eligibility, they'll say, oh, I got it. Well, you got the wrong one. We got to go back to the college and get you the right one.
During my research, I saw that there was like 5,000 internationally trained physicians unable to practice in Canada. Is that number accurate, or do you have a different number?
I think it's like, yeah, it's kind of accurate, yeah.
So what do you think needs to happen to better utilize this talent? Like, what else can we do to use these guys? Because
to bring more doctors in?
Yeah, just everything. To make processes, like what processes could be done easier, what needs to happen?
I wish it was as easy as saying that, make it just Canada-wide, you get your license, it's this license and this license, right? If one province says you need MCCQE1, one province says you don't need it. Like, they need to streamline it for these IMG physicians. And I think if all provinces can come to like an agreement that, or like, we're crying for physicians. We need doctors, but just streamline it. Just make it easy. Why are you saying to this one physician, oh, yeah, you can come to Canada and practice, but sorry, you can only practice in New Brunswick. Oh, yeah, you can come, but you can only practice in British Columbia. You can't practice in Ontario, right? We are here to guide, but there's only so much we can guide. We can't streamline the process, but if, they streamline the process, it would be easy. Like, yes, we have specialists coming in, amazing. But we do see a significant shortage in family physicians, right? Mm-hmm. We know there's so many, people that don't have a physician. But we have these practice-ready assessment programs, okay? We have these programs, but why can't the province work with someone like us, recruiters, and say, okay, well, you know what? Do you have physicians who would be eligible for a practice-ready assessment in Ontario or whichever province? And we do, because we know that we do. But because the practice-ready assessment process is so, also using the same word, daunting, it's so competitive. It's so hard for physicians to get it. Why? Mm-hmm. Why? You have a physician who is eligible, who has 20 years of experience. All they want to do is come to Canada. That's all they want to do. They want to come to Canada for a better future for their family. They want to practice in Canada. I have a physician who, amazing individual to speak to, but he's working at a convenience store. But he has like over 20 years of experience. So all they need to do is streamline it. Like, yes, you want them to do this 12-week clinical assessment, but we can help bring so many physicians in if you just let us help.
Mm-hmm.
And how many of those 5,000, give or take, that are international medical graduates that are here in Canada already? Do you have a sense of how many are family physicians? How many are specialists?
It's hard to say. It could be 50-50 because it just depends on who we're talking to. But I want to say a handful is family physicians. Handful is family physicians.
Yeah, I agree. I think that, at the end of the day, the ministry, the government, all the bureaucrats, they need to do something to make things a little bit more simple or easier, whatever you want to call it, to fix the problem. Like, we only see year after year that things are getting worse and worse rather than better.
Yeah. And I mean, like, like what you're saying, like, it's just getting worse and worse. Like, if you want more physicians, bring more physicians, but don't scare them away with the process.
Right.
I think, like, in the recent article, they just said that they wanted to have more physicians in the PRA program, in the Practice Ready Assessment program. But how do you expect to get all these physicians? Like, there's so many physicians out there who have the requirements, but they're not able to get that spot because you've made it so competitive.
For sure.
Mm-hmm. And so has, Jane Philpott, has she reached out at all, or have you guys reached out?
I have never connected with her, but I do read her like articles. I've seen like her on in the articles and stuff, but I've never actually spoken to her or like had a conversation with her. No.
Yeah, I mean, she should know about you guys, right? So,
I was laughing
at her an email.
with my husband today, actually, and I said, you know what? I see like Doug Ford saying all these things. Oh, we need a physician. There's a new like school in Brampton, new med school. But what are you gonna do? Like, you're not there. You're building a med school in Brampton. Beautiful, great. You're giving this opportunity. But they still have to go through school and finish. So even if it's 5 years, 6 years, 8, what are you doing in that time to fix the shortage of physicians?
Nothing.
Nothing.
Yeah, you need to call Dr. Rohini Patel, MD, at Can Physician Recruiting and fix the problem.
Yeah, seriously. And like, they make it, especially like for recruiters like us, they make it so difficult that, for example, Cortalucci Hospital, Major Mackenzie, right by my house. I want to help place physicians, but sorry, my phone. I want to help place physicians, but you email the chief, you don't get a response because they're busy. Understood. Okay, department head busy, residents busy. How do you get through to these hospitals to say, hey, I have a pediatrician or I have a psychiatrist interested in Ontario, able to get licensed, has everything, just needs an interview, just wants to meet with you. How? You can't get a response.
Oh my
Yeah,
goodness.
it's terrible. They need, I mean, the hospitals in particular, I mean, it would be great if the HR department or someone in management of some sort could sort of take the reins and work with you guys, because you're right. The physicians don't have time to answer 100 emails.
They don't.
Perhaps, if they let the HR person or whoever in management take care of the majority of the process, and then when it comes to it, they can meet the physician to see, physician to physician, what the relationship can be, and they can ask different questions that us non-medical people can ask.
Exactly. And, I think that's the one thing about our team at CanAm, that when we, even like if it's a new client that kind of questions or like contacts us, and I tell them that basically I'm taking all the work off of you. You don't even have to tell the physician what to do. I am going to take them through the entire process. Your only job is to meet with them and make sure they fit in with your team and start providing care to the community. That's it. You don't have to do anything. I will make sure that they get licensed by the governing body, but you don't have to do anything. Just meet with them. Just give them an opportunity. We keep saying close the gap, but there's so much that can be done to close that gap.
Absolutely.
Yeah. Wow. That's a great way to end this conversation. Time to close the gap. Thank you so much, Dr. Patel. for coming on our podcast, and just, we love your enthusiasm and passion about this, and we are right with you. So yeah, thank you again. Is there any last words you have?
Just thank you, Rebecca and Josh, for having me on the podcast today. It's been a pleasure to share how we at Can-Am support our physicians from all backgrounds. Trying to make it easier, like we said, trying to close that gap. But thank you so much. And for anyone that's listening to today's podcast, if you want to connect with me, I'm sure there'll be the link. More than happy to connect with you and walk you through the entire process. We're here. We want physicians in Canada. We want to make it easier for you. So feel free to connect with us.
That's awesome. Yeah. Thank you so much. And yes, we would love to continue working with you. It's definitely not a one person endeavor to undertake. So the collective team, Healthion, is definitely all about the team approach, team-based care. So we'd love to continue working with you and keeping the conversation going.
Of course, for sure.
Awesome. Yes, and I will put all important links and contact information in the podcast notes. And so to our listeners, thank you again for joining us for another episode of Prescription for Primary Care. Make sure to like, comment, share, and subscribe to our channel for more content. Until next time, good health and better healthcare.